Hi there, Tracy from Kazadans Equestrian, and welcome to this week's video. If you're new to my channel, please have a look around. Don't forget to subscribe, like, comment and share my videos around, and also click that notification bell and you'll just get told then when I do release my next video, which is normally only about once a week. Today's video I'm going to have a look at choke in the horse. What is it? Why is it an emergency? Can they breathe when they're choking? And what can I do? Okay, so a horse choking is an equine emergency. However, what I want you to understand is this isn't an emergency similar to if we as a person was choking. So I guess all this does is allow you to calm down a little bit and not panic that you can't do anything immediately. When people talk about choking, we're talking about blocking our windpipe or trachea. Obviously, this is hindering the oxygen getting into our lungs, so it's a lot more of a significant issue for us than the sort of choke we talk about with horses. When we're talking about choke with horses, we're actually talking about a block in the esophagus. So the esophagus is the muscular tube that goes from the mouth down into the digestive system and moves the food along. If we remember from some of my other videos, the horse doesn't actually breathe through its mouth. So the fact that going into the mouth is blocked is not as significant because the horse is able to breathe through its nostrils. And that's actually the only way horses take in air, so they breathe through their nostrils, down their trachea and into their lungs. So that at least explains why it's not a critical emergency. However, it really can have severe consequences, choke, so it still is a veterinary emergency and it's quite common. So what does cause choke? A horse could maybe eat a lot of pellets suddenly, and that can form this sort of bowl of food that's a little bit too dry and gets cramped and stuck in that esophagus. Another thing would be feeding some of the feeds that should be soaked and feeding them dry can gather some of the saliva on the way down, start to swell, and again cause a block in that esophagus. Sometimes hard treats like even carrots and apples, if they're given to them at a size where they're not chewing and they're swallowing, but they either clump together or they're large enough to lodge through the esophagus, that can cause choke. Sometimes even hay. I've seen this with a hay that is quite fibrous, not as strong in the straw, but like lots of little netty fibers in it, and the horse eats that and it makes again this sort of distinct ball that can get trapped in the esophagus. One of the other ways hay can cause this, even straw, is if the horse isn't chewing properly into small size particles. So this can either be a horse that's just too hungry, lazy, not chewing properly. It can be that their teeth aren't correct. So if they've got dentition problems and they're not chomping that hay up properly, this can cause choke as well. Some horses even have an unusual esophagus anatomy, so it's a little bit different. Maybe it's got a curve or a kink, and this can predispose them to choke as well. If your horse is choking, what is it that you're going to see? Well, in the extreme cases, you'll arrive to find your horse with its head in a very low position, quite often really badly salivating and even food particles and fluid pouring out of its nose and mouth. And at that point, that's a fairly severe choke. You can also see more of a minor choke in a horse that is hypersalivating, so a lot more salivation than normal for no reason. A horse that's not eating, even minor kind of colic symptoms, and also a cough. If you notice your horse sort of coughing or trying to cough, or even looking like they're trying to vomit, this can be an indication of choke as well. Now, although it isn't as time important a choke as it is in people, choke still has very serious consequences, so it is important that you call your veterinarian. Sometimes a vet will ask you to wait for a certain amount of time. As long as you're under veterinary care, this is fine. Like I said, remember, your horse can breathe. What's really important though is while you're waiting for your vet, do not let your horse eat anymore. Any more is just going to add to that impaction in the esophagus. To do this, you may have to continually walk your horse around or keep its head off the ground or even use a muzzle so that your horse doesn't continually try to eat and put more food in. Don't administer any medications unless you've spoken to your vet and they've suggested you try something. Don't try that, and please, 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 100%, do not try shoving a hose down your horse's throat to move the blockage. Why not? Well, even though they breathe through their nose and not their mouth, there is still behind here a connection between the trachea and the esophagus. And these are very carefully controlled. Something like a hose going into the horse's mouth really risks food particles or water going straight down into your horse's lung, and you're at real risk of a pneumonia, aspiration pneumonia in your horse, and this is really serious. So please don't be shoving a hose or anything and forcing down your horse's mouth. So there are two ways here that your vet is going to treat the choke, and it really depends on the severity, your vet's experience, etc., etc. But the two ways are to tube the horse under sedation. At this point, they very carefully flush with water and try and remove the food obstruction. If this is a major obstruction, this actually can take quite a while. The other thing that your vet may do is simply offer some sedation, some muscle relaxants, so the esophagus muscle relaxes, and just observation to see if it will clear itself. Quite often chokes do clear themselves, but you really don't want to be at risk of what could happen if you don't clear this up. During this, the vet's likely to give your horse some fluids, etc. as well. So as you can see, it is very important to have your vet on hand, and I would be calling the vet straight away, even if the vet says, call me back if it hasn't cleared in 15 minutes on its own. If it's mild, at least that vet is aware and ready to come if necessary. The real concern here is the overstretching of the esophagus, and in fact, what we really don't want is the horse to continue eating, make this bigger, and even burst the esophagus. If neither of these techniques work on site, then your vet is likely to want your horse to be transported then to a special facility, and endoscopes, etc. will have to occur. But most likely, even though you do need your vet involved, they are mostly cleared on site. Following a choke episode, the horse does need some extra care. Your vet, for example, may want to do preventative antibiotics. The reason for this is even if they're doing the tubing, regardless, there is some chance of food particles or something going down into the lungs, and as a preventer for the aspiration pneumonia, they may want to have your horse on antibiotics just in case. You will want to monitor your horse's temperature the next few days after a choke episode as well. Why? Because we also want to be right on top of any chance of pneumonia developing. A fever can be the first sign. Depending on the severity of the choke, your vet may want to also offer anti-ulceration of the esophagus type drugs, which may be warranted. But you yourself may need to withhold different types of feed for several days until this is resolved properly. The safe foods are something like a soupy mash, so your beet pulp, your soybean pulp, making sure it's in lots of water with some nutrients, multivitamins in that, but something that has no chance of getting stuck. And if this is working, then you can start even hand picking grass to give them that forage, and then maybe even start hand walking on fresh grass grazing. You do not want to reintroduce dry, hard feeds immediately. Ongoing, if your horse is one of those that simply gulps down its pellets so fast that they tend to do a bit of a choking episode with that, what you can do is get some fairly sizable round rocks and mix that up in your horse's feed. So they really have to use their lips and forage around to eat, and that will reduce the risk of them grabbing a whole heap of pellet at once. And lastly, because poor dentition is one of the leading causes of choke, after your horse has had a choke episode, please get somebody to also look at their teeth. Okay, so just to recap, yes, it's a veterinary emergency. Yes, I would be calling the vet immediately to follow their advice and also put them on warning. But no, don't panic and think your horse can't breathe, because they can. So the emergency isn't needing to be attended to within 5 minutes, and your vet will be able to guide you with that, the treatment, and hopefully some aftercare. I hope this video was helpful. Don't forget, please subscribe, like, comment, share my videos around as much as you can. It helps me support this channel, and I will see you next week with my video then. Thanks for listening.